Thank you for joining us today. I'm Patrick Laidlaw, Director of Business Development for Integration, and I'm going to take care of a few admin things real quick while we get started here. Keep everybody on track and on time. So first of all, if you would and can disable your note taker with AI, that would be helpful. Last webinar, we had a little challenge where the chat box was getting blocked, just filled up with AI note taker permission requests. So people had a hard time following. So if you could disable it or at least mute it, keep it quiet, that would be great so it doesn't fill up the chat box. We will be answering questions at the end of the webinar. And when I say we, I mean Mariana, the smart one of this webinar. So other questions we've had is, are these CEU accredited? These webinars are not CEU accredited. They're for information only. This is the actual research coming out of the school. And so the LHRC is building a CEU for us as we speak, and we should have that ready by the end of the month. So we will have a CEU containing a lot of this information from these 3 webinars built by the LHRC. So ask your local representative or get with WAC or Spire. We'll be able to follow up with you on the CEU once it's ready. So without further ado, let's get started. I'd like to welcome you all to the 3rd installment of our 4-part webinar series, The Science Behind Lighting's Impact on Health and Wellness. The WAC group is sponsoring these educational webinars, and they were created in partnership with the Mount Sinai Light and Health Research Center, the LHRC. The LHRC brings together a highly skilled group of researchers, educators, and designers who are passionate about what light can do to improve the lives of people and sustain a healthy planet. They collaborate with a diverse array of partners from industry, government, academia, and other communities to conduct groundbreaking interdisciplinary research. We'll be posting the registration links for the remaining upcoming webinar and the recorded versions of this and the past webinars at the end of this presentation, and Mariana will be taking questions at that time. So I'd like to introduce you to our esteemed educator for today's session, Mariana Figueroa, Professor and Director of the Light and Health Research Center, Mount Sinai School of Medicine. Mariana Figueroa, PhD, is among the world's leading experts in the area of light and health, with a focus on bridging science to practical applications aimed at improving human quality of life. She has made a significant impact on this developing field and continues to actively expand her influence through translational research and teaching. She is the director of the Light and Health Research Center and serves as principal investigator of various research projects at the center. She regularly collaborates with lighting designers and manufacturers through her work with the center's Light and Health Partners Program. Dr. Figueroa previously served as the director of the Lighting Research Center at Rensselaer Polytechnical Institute. So Mariana, all of that out, you're a really smart person. I'm just going to cut right to the chase. You're incredibly smart and versed in these subjects, and I couldn't be more thrilled to have you with us today. Thank you for joining us.
Well, thank you so much, Patrick, for inviting us, and thank you, WAC, for sponsoring the event. We are excited to talk a little bit about the work that we've been doing. And I always tell people this is almost like a tool in a toolbox. So it's something for you to keep it, and there is no one size fits all, but there are basic principles that hopefully you're going to get out of this talk that will help you with making decisions out in the field. So again, I would like to acknowledge WAC and also our project sponsors. And I do want to point out, which I think it's very important to point out, we have been very fortunate to have federal funding, especially from the National Institutes of Health, to support a lot of the research that we have been doing. So I'm very appreciative of all the research sponsorship that we have had up to now. So let me start with a very simple question, and I think a basic question is, what is light? And there is a formal definition for light, and that's from the Illuminating Engineering Society of North America, or IES. And according to the IES, light is radiant energy that it's capable of exciting the retina and producing a visual sensation in humans. And I think that's very important because the definition of light is limited to the visible portion of the electromagnetic spectrum that spans from about 380 to 780 nanometers. Basically, what the definition entails is that it's radiant power weighted by a luminous efficiency function. Usually it's what we call the photopic luminous efficiency function. So when you get a light meter and you see the lux values, that's what that is. It's getting energy that comes out of a light, and it's basically weighting it to that photopic luminous efficiency function. Now, this function takes into account only 2 out of the 5 photoreceptors in the eye. So it doesn't really represent the full range of the eye sensitivity. And Mark Ray, in the previous presentation, if you haven't seen it, I recommend you do see it, does explain in a lot more detail that. Now, the other question is, what is human-centric lighting? And I think that's a buzzword. Everybody's hearing about it. And this is a very busy slide. It's not meant for you to read, but it's meant to basically send a message. There's a lot out there about human-centric lighting. So there's different websites, different people's, there are papers people have written about. But basically, the idea and the concept of human-centric lighting is that we want to think of lighting as more than just vision, right? Lighting is for humans, and humans are not just about reading black font on a white paper, which is really what the formal definition of lighting is. So the human-centric lighting should basically include how you feel about it, the aesthetics, and one of the very important part, which is what I'm going to be covering mostly in this talk, is what we call the non-visual effects, which is really how light impacts our sleep, circadian rhythms, and other systems in the body that it's not really included in the definition of light. Now, one of the mistakes that have happened up to now is that a lot of people associate human-centric lighting with tunable lighting, with a specific product, and it's not. A tunable lighting can be used to implement human-centric lighting, but it's not necessarily needed to be used, or it's not the only thing that would allow one to implement human-centric lighting. And that's hopefully what you're going to learn a little bit more in the next few slides. So we have sort of this framework of what, human-centric lighting would be, and it really is based on the fact that we know that lighting affects at least 3 systems in the human body. One is the visual system, which we all know, and the Illuminating Engineering Society has a formal definition for that, even though within the visual system, the formal definition from the IES pretty much includes the visual performance, but not necessarily the appearance or the brightness perception, for example. Then we have the non-visual systems, which is really how light affects your circadian rhythms. And even within that non-visual system, you have what we call the phase shifting effect, which is really maintaining your biological clock in sync with the day. But also, I like to refer to lighting as a cup of coffee. And that's actually different than the phase shifting effect. So even within the non-visual effects, we have different outcomes that we can measure to understand better how light affects those non-visual effects. And then you have the perceptual system, which includes not only our cultural experiences and expectations, but it also has to do with our perceptual system. And I'll talk a little bit about that, some of the work that we've been doing looking at how to give horizontal vertical lights to reduce falls in the aging population, for example. So very briefly, because again, Mark covered a lot of that in the previous presentation, for the visual system, if you start thinking about lighting characteristics, amount, spectrum, distribution, timing, and duration, and how that affects the visual system, we actually have a very good understanding of that. If we know the visual size, the luminance contrast, the retinal illuminance, the age of the observer, we can actually predict what the relative visual performance would be. And I can tell you, you don't need to do all the calculations to do these predictions, because if you follow the recommended practice from the IES, you're pretty much going to be in the plateau of these curves, which means you're going to be at the highest performance that you can have in terms of the relative visual performance. Now, task performance or visual performance or reading black font on a white paper, it's not everything that the visual system does. One other way of seeing it, of us experiencing the environment, is what we call brightness perception. And what we know, for example, if you have brighter environments, so 100 lux compared to 350 lux, for example, a space that it's illuminated at 350 lux will appear brighter than the one illuminated at 100 lux. But what's also interesting is at those same light levels, a cool light sources or a more bluish white light source will appear brighter than a warm light sources, even though your light meter is it's reading the same illuminance. So that means that there's sort of a different wiring diagram in the brain that makes you feel the space is looking brighter if you have more of a bluish white light sources than if you have a warm color light sources, for example. We also like for color appearances. I mean, there are certain tasks that we do in the space where color is very important, and we have to select light sources that will interact with the finishes in the environment that allows us to perceive color in the space. And then you have the distribution of light. When we're doing lighting for the visual system, we care a lot about minimizing glare, minimizing reflections, and minimizing shadows, unless reflections or shadows will actually help us see the task better. But in general, for the lighting the environment, we want to minimize those three things in terms of the distribution of light. Now, in terms of the sort of perceptual system, um, light actually um, gives us a message in the space. So, for example, when you go into a business, if the lights are off, you say, oh yeah, it's closed. Or if the lights are on, you know the business is open. So there's just as simple as that. But it also has this message of um, following what people like. So people have a preference for view, or there is what they call a biophilia hypothesis, which is the hypothesis that we have this need to be in touch with the external environment. So depending on how you like the space, or if you have a window in the space will feel different for you. And a lot of what lighting designers do is they actually understand how people will react to the lighted environment, and they exploit that to make better environments for people. And then we have what we call the perceptual system, which is, as I mentioned, we have shown that some of the work with older population, if you have those horizontal vertical lights as night lights, for example, it actually helps people increase postural control and stability and reduce falls risk in certain populations. And then you have what we call the non-visual effects of light. And obviously, this is going to be the majority of the presentation from now on. And this has to do with the circadian system. Circadian rhythms are every rhythm in our body that repeats at approximately every 24 hours. Circa is about, or approximately, D is a day. Circadian rhythms, they're generated and regulated by a biological clock in the brain. So we all have a master clock in the brain. And we actually don't need the external environment to continue to have those circadian rhythms. The only difference is if we are in a dark cave, these rhythms are going to what we call free run. So they're going to run with a period slightly longer than 24 hours. In humans, on average, is about 24.2 hours. So if you have no external cues or no light dark patterns, you're going to continue to have circadian rhythms, but these rhythms far. So you would be out of sync with your watch every day by about 10 or 15 minutes. So if that happens for 2 to 3 weeks, you basically would be very much out of sync with your clock, because your clock starts ticking, but your internal clock is ticking a little bit slower. And that is what we call circadian desynchrony. So light is the primary synchronizer of circadian rhythms to the local position on Earth. So every day in the morning when you wake up, you actually reset your biological clock so that it runs with a period of 24 rather than 24.2 hours. So what it does, it synchronizes daily your biological clock to the local time on Earth. Now, if you don't get enough light in the morning, especially in the morning, but anytime during the day, but mostly in the morning, or if you get too much light at night, which is the time that we are supposed to be in darkness, light can also be a major disruptor. And disruption of circadian rhythms has been linked to a series of maladies, from poor sleep and poor performance, all the way to if you are a shift worker, for example, where you're disrupted for many, many years in a row, you are high risk for diabetes, obesity, cardiovascular disease, Alzheimer's disease, and even cancer, for example. So we don't want to have circadian disruption. We want to try to avoid circadian disruption as much as possible. So one of the circadian rhythms that we basically experience and know very well is the sleep-wake cycle. We as humans, we're diurnal species, and we're supposed to be awake during the day and asleep at night. And that's supposed to happen every day. Now, why is it that sleep is so important? There's a lot of work being done in trying to understand the importance of sleep. And we now know that one of the things that sleep does is sleep cleans up the debris in the brain that we accumulate during wakefulness. So every time when you're awake, you're accumulating that kind of debris in the brain. And then when you sleep, you actually have the interstitial fluid that comes through your brain and basically washes off that debris in the brain. So, for example, sleep disturbances or sleep curtailment has been linked to increased risk for Alzheimer's disease, because the hypothesis is that you're not cleaning up that debris in the brain, and that may be leading to increased risk for Alzheimer's disease, for example. The other sort of a task that sleep does is it promotes learning and consolidates memory. So one of the things that they've done studies they've shown is if you learn something in the evening and you have a good night's sleep, you're going to do better in the morning. Now, if you learn something in the evening and you stay all night awake, you're going to do worse in the morning. So that's a good lesson for all of us that will try to study for an exam the following morning. You're much better off learning it in the evening, getting a good night's sleep, than staying all night trying to learn what you need to learn for the exam. Now, the other question that we have is, what is light for the circadian system? Okay, so we know that the formal definition of light by the IS does not include light for the circadian system. We also know that all classes of photoreceptors, your rods, which are mostly used for nighttime vision, your cones, where you have three types of cones, the short, middle, and long wavelength cones, and your intrinsically photosensitive retinal ganglion cell, or IPRGC, which is your melanopsin ganglion cell. That is the novel photoreceptor that was discovered in 2000. They all participate in how the retina converts light signals into neural signals for the circadian system. So there's a lot that's been said on the melanopsin, because the melanopsin, the IPRGCs, what they do is they collect the information for all of the photoreceptors in the retina, and they send that information to the biological clock in the brain. So they're a very important photoreceptor. However, they do receive input from the other photoreceptors. So anytime that you consider just one photoreceptors, you're actually not including the other photoreceptors that also participate in how the retina converts those light signals into neural signals for the circadian system. Now, based on what we know from the sciences, there has been a lot of lighting practice recommendations. I mean, a lot of these recommendations has been based on metrics that are out there. And these metrics are really done to sort of like understand a little bit how the circadian system responds to light. One of them, and that one, full disclosure, I did work on the development of the design guidelines. Mark was the chair of that group, and we had a group of scientists and people that were interested in this area that helped develop this design guideline. This was published by the nonprofit part of the UL. And we proposed as sort of a basic metric would be the use of circadian stimulus. And the circadian stimulus metric, I'm not going to get into a lot of details, but it's a metric that we developed that takes into account the influence of all 5 photoreceptors, and it takes into account the data that had been published looking at acute melatonin suppression. And melatonin, it's a hormone we produce at night in darkness. And melatonin has a very close link to the biological clock. So it's an outcome measure that was very useful for us to understand the spectral sensitivity of the biological clock. So basically how the clock responds to the spectrum of light, as well as how the absolute sensitivity. So in other words, how much light does it take to affect the biological clock? So we have been using the circadian stimulus metric in the field, and I'll be showing some of the work that we have been doing. But I do want to point out that the UL design guide, it does include the other metrics too. So if you are doing a project, for example, with other organizations such as the WELL, which I'll show in a minute, you can actually also meet the criteria by following the UL Design Guide 24480. So again, the UL recommend this circadian stimulus of, or CS, of 0.3, which is just a unit, and I'll show you a calculator that you can calculate that CS for at least 2 hours in the morning. And the reason for that is because, remember, we need morning light to maintain the synchrony of the biological clock. The WELL standard, they advocate for the equivalent melanopic lux. They had an alternate path for CS as well. So their recommendation is at least 150 equivalent melanopic lux, and then they added the melanopic EDI, which is the CIE one, or at least 275 EML or 250 melanopic EDI for at least 4 hours, beginning by noon at the latest. I don't know how they came up with those numbers. I do know how we came up with a CS of 0.3 because we've done some of the work in the field that show that helps improve sleep, and I'll show you some of the data in a minute. I don't know how the WELL came up with that, but I can tell you from the work and the calculations we did for the UL, those numbers are pretty close to the CS of 0.3, so there isn't a lot of difference. If you're going to be using the WELL standard, you're probably going to be meeting that CS of 0.3. And then the CIE recommends this melanopic EDI. Their recommendation is 250 melanopic EDI during the day and less than 10 melanopic EDI at night. And again, we don't know how they came up with those numbers. But those numbers tend to also not differ too much. So the bottom line is that however you decide to do it, you can use, and you're going to get pretty much in the ballpark. And the bottom line is that all you want to have is high light levels in the morning, low light levels in the evening, and darkness at night. This is what you want for good human-centric or circadian-effective light in a way. So this is the circadian stimulus calculator. That helps you calculate that CS or circadian stimulus based on having the illuminance at the eye, the spectral power distribution or SPD, and you can get that from manufacturers. And then you can calculate what your CS is. Now, if you're doing a job where you want to calculate the EML or the melanopic EDI, the CS calculator will give you those numbers as well. So that's a very handy tool. It's It's freely available on the web. There's the website there. And if you have to do a job, I recommend that you use the CS calculator because that will help you um, make sure that you're meeting all these different metrics, which you're probably going to be depending on the light levels that you're putting. And I'll give you some clue of what that should be to make sure that you meet all of these requirements. But that's a very handy tool if you want to start doing those calculations. Now, it is not just about spectrum and amount. It is also about how much, which is amount, what's the spectrum, which is color, but it's also about how long. How long are you exposing people to the light? When? Is it morning? Is it afternoon? Is it evening? Is it middle of the night? Where? And where is, are you giving light at the eye? And that's really what the circadian system cares about. It's not horizontal illuminance, it's light at the eye. And then is there movement from one space to another? So in other words, are people going to be in that space the entire time? Or are you moving from your home to your office, to your gym, to your evening, you're going to go to a basketball game? So what is happening? You have to try to understand what people do and then try to at least bracket the light. So make sure you control the morning light, make sure you control the evening light, and that will, at a minimum, help you maintain that healthy lighting that you need. But in very, very simple terms, we need bright days and dark nights, dim evenings, dark nights, okay? And bright days, there's nothing better than daylight. But unfortunately, not all of us have access to daylight because some of us are interior offices, some of us are working in our basements, some of us are going to work in the dark and working in interior offices and going home in the dark. So we may spend days in the winter where we're not getting that day. So we would have to account or we would have to consider electric lighting to help us with that. And for electric lighting, this is a very simple way to implement that. You want to have bright mornings, and so that is greater than 35-foot candles or 350 lux at the eye levels. From half an hour to 2 hours, within 2 hours of waking, I recommend more like 1 hour to 2 hours than half an hour. But if half an hour is all you have, is better than nothing. Patrick and I have a joke saying that the best thing you can do is get a puppy because the puppy will force you to get out of bed every day at the same time because regularity is very important for the circadian system, and it will force you to go outdoors. And the best light you can get is outdoors. Obviously not in the winter because sometimes you have to go in the dark and that's not going to help you. But after daybreak, that's the best light that you can get. You want to have moderately lit light, moderately lit daytime environment. Now, if you can keep the light levels in your environment high all day, that's pretty good. However, you have energy concerns, so you may not be able to do that. So you do it in the first couple of hours in the morning, then you can bring it down to regular lights that you normally find in the built environment, 10 to 20-foot candles or 100 to 200 lux, up to 2 hours prior to bedtimes. And then that's when you get in your dim evenings. You want to reduce the amount of light at the eye, less than 30 lux at the eye or 3-foot candles. And then you want to have dark nights. You want to really sleep in darkness, but maintaining your safety. So you want to use night lights to facilitate navigation in the space if you have to wake up in the middle of the night. Now, one point that I do want to make is that circadian effective light is not just about the spectrum. And in fact, spectrum is probably a second order magnitude compared to amount. A lot of the manufacturers sometimes will only talk about spectrum, and you really need to think about amount. So this is a study that we did. We did some calculations and we said, okay, we want to reach a CS of 0.3 at the eye, which is the UL design guide. If you have 300 lux on the work plane, which is following the IES standards, by the way, for visibility. If you use a 3000 K light source, 0 out of the 12 sources that we tested would meet that criteria. And then if you have a 5000 K, which is a more bluish white light source, 2 out of the 12 met the criteria. So it's not much different if you are at 300 lux on the work plane. Now, if you jump to 500 lux on the work plane, so if you increase light levels, 9 out of the 12 in the 3000 and 11 out of the 12 in the 5000 K meet that criteria. So there's a much greater difference when you increase light level than when you change spectrum and maintain lower light levels. So remember that, because a lot of times you don't have the budget to do tunable lighting, but that doesn't mean you can't do good lighting for the circadian system. You can use a dimmer, and that should be enough to meet the requirements for the circadian system. So here is just, basically a cartoon of what we just talked about, that you can wake up, you have higher light levels in the first couple of hours that you wake up, then you can come down to normal light levels, and then you start bringing it down over the course of the day, and obviously turn off at night. Now, in terms of how much, how long, and when, you definitely will need some sort of controls. You can do a simple control, like I said, manual or automatically, very easy to use, or you can go more complicated. You can do sophisticated controls where you program that with a tunable white or tunable light sources that changes the spectrum from 2700 to 6500. You can do it. It can be done either way. Just don't think that you cannot do it if you don't have the budget to do something more complicated. Now, I do want to stress where you have to think about light at the eye. You cannot think only about light on the work plane. So start thinking about, how is it that I'm going to get the light at the eye? So painting the walls on a light color will help reflect more of that light back in the eye. Having vertical windows will help you have more light at the eye. Getting something around your computer screen will help you have more light at the eye. So think about how you increase that light at the eye. But you have to make sure that you're minimizing glare. So the UL design guide actually limits the luminance of your light source to less than 8,500 candelas per meter square, which we showed that it's sort of like acceptable brightness of a light source. But you do want to diffuse the light sources. You don't want to have direct view of the light sources. You want to really minimize the discomfort of increasing light levels at the eye. So why does it matter, and what does the science show? So I'm going to make a few statements, and I'm going to show you the data of some of these statements, okay? So the first one that I can tell you is light improves sleep in daytime workers. Okay, so this was a series of studies that we did. One of them was during COVID. We ran a very large survey. We had over 700 respondents. And of these 700 respondents, we had about almost 600 of them were people that were working from home or were unemployed staying at home. And the hypothesis was, when COVID came, we suddenly had to move in home. So we didn't have the infrastructure to work from home. So we had to go to our basements, our closets, our mini spaces, whatever it is that we could have privacy to do a meeting. And what was happening? We were probably getting very little light during the day. And we know that more light during the day leads to better sleep. And in fact, this is what the survey here says. We asked people at your at-home light exposure that went from very bright to very dim. You could see that, and just to explain the x-axis here, is 50 is sort of the norm. Anything above 50 is worse sleep. Anything below 50 is better sleep. So you can see that if the lights were very dim, they actually had more sleep disturbances and more sleep-related impairment. And as the light levels increased, that was diminished. The same thing with the time spent outdoors. We asked them, how long are you spending outdoors? If they were spending less than 10 minutes outdoors or between 10 and 30 minutes, they were having more sleep disturbances than if they were spending 1 to 2 hours or more than 2 hours outdoors. So again, it's a nice relationship. The more light you get during the day, the less sleep disturbances you have at night. We also did a study, and that was with View. And what they had those electrochromic glasses. And what these facades are is that they remove a lot of the IR because they want to remove a lot of the glare, remove a lot of the heat, but they do let in a lot of the short wavelengths. So the environment, and if you can look at this, at the image there, it looks a little bit bluish, and that's because they keep all of the blue light, which, believe it or not, is very good for the circadian system. So it's actually, that's the reason why we did the study, because without them knowing, they actually had a product that would be beneficial to the circadian system. And we actually saw, we did a study where we compared with those electrochromic glasses or with clear glasses and shades, because people tend to pull the shades if they have sun in coming in the space, and they have glare, so they tend not to have full shades open and cover some of the daylight coming into the space. So what we showed is that when they had more of the short wavelength coming from that view glass, they actually had more sleep regularity. And sleep regularity is also very important for health. They also, what was interesting is that we saw that the sleep regularity was decreasing with with the with the blinds. So when you didn't have circadian effective lighting, in a matter of week or 1 week, the sleep regularity decreased, and it increased with the view. So basically what we saw was that an improvement by just giving people that light during the day coming from the windows. Now, light also improves sleep in persons with neurodegenerative diseases. So it's not just office workers or regular workers. It's also people that suffer from neurodegenerative diseases. And one of those people are the Alzheimer's disease and related dementia group. And we've shown that light improves sleep in Alzheimer's disease. So if you can look at here, the sleep disturbances graph, which is the first graph on the left, this is a project that we did. It was a 6-month light exposure. So we actually increased the amount of light in Alzheimer's patients that were living in nursing homes. And we collected data at baseline before the lights, and then 3 weeks, 9 weeks, 17 weeks, and 25 weeks after the lights. And we saw a continuous decline in the sleep disturbances with the light exposure. Now, it's pretty impressive because these people had Alzheimer's disease, and yet after 6 months, when the disease was getting worse, their sleep was getting better. And if you see the red line here on the graph on the left, which is the sleep disturbance graph, you can see that there's a significant um, uh, the decline is so significant that it's actually below the threshold for having sleep disturbances. So we actually help them go below the threshold for sleep disturbances. So they didn't have sleep disturbances anymore at the end of the study. And again, think about how long in the life of an Alzheimer's patient, 6 months, how much the disease had progressed. And yet we were able to show an improvement with the sleep. And then we also saw an improvement in sleep duration in Parkinson's disease. So we did see that by giving them 4 weeks of a lighting intervention, we increased that sleep duration in this group. So this was a very small study. It was a pre-post study, only 4 weeks, but we did see the benefits. So we're now writing proposal to increase the sample size and increase the work that we want to do with the Parkinson's disease population. So one of the things that we know is that brighter days will lead to better nights. And that's really something that you should keep in mind, because I think the science is pretty clear and the science is pretty solid on that. Now, the other area that we're seeing significant improvement is in mood. And light does improve mood in various populations. So this is the work that we did with Alzheimer's disease, and that's the same data that you saw from the sleep disturbances. Now I'm showing the data that we collected in the same protocol for depression and agitation. And again, we saw a continuous decline in depression and a continuous decline in agitation. And for the depression, same thing that happened with sleep. They ended up below the threshold for depression. So they started depressed and they ended up the study not depressed. And this is just by providing them lighting all day during the day while they were in the facility, which is where we deliver the light. And this is the COVID-19 that I mentioned with the sleep. These are the results for anxiety, depression, and positive affect. Again, same thing. The lower the light levels they were exposed at home, or the fewer number of minutes they were spending outdoors, the more depressed and anxiety they were self-reporting. And as they increased that amount of light exposure during the day, they decreased anxiety, decreased depression, and they improved positive affect. We also saw in that same VIEW study, we saw better mood in the workers from home. So in other words, they self-reported sleeping better, and they also self-reported an improvement in their positive affect. So are sleep and mood linked? Probably, because there's been studies showing that if you don't sleep well, your mood gets worse and vice versa. So I clearly think that perhaps the mechanism that light is improving mood is through better sleep. But light also has a direct impact on mood. It's been shown that there's a direct pathway in the brain that goes from the retina to areas in the brain that control mood. So I'm not surprised that we saw these results, but they're definitely very, very clear results. Same thing that happened with cancer patients. These are patients that were undergoing myeloma transplant. We deliver the light in the hospital, and we saw that after 14 days in the hospital, we did see a significant improvement in their mood. So they were basically, the depression scores were lower in the bright light compared to the dim light. Now, light also improves cognition in individuals with mild cognitive impairment. And this is actually very new data. It's still unpublished, but these are one of the latest results that we're getting, because we're working now with mild cognitive impairment patients, which mild cognitive impairment is before you get to have Alzheimer's, you start having these cognitive impairments. Sometimes it develops into Alzheimer's and sometimes it doesn't. But what we're seeing is that there is an improvement in ADAS-Cog, and ADAS-Cog is a very well-known test for memory that typically is given to this population. And a negative value here indicates improvement in cognitive performance. So we have a placebo light, which is a circadian ineffective light, and we have an active light, and we gave that light for 6 months. And we see that with the active light, or with the circadian effective light, which was a CS of 0.3, we did see more negative values, which means that they improved cognitive performance. And the reason why a negative value is better is because it's fewer errors that they did in the test. So they were able to remember more things in the test. So that's why it's better performance. So we're very excited about that. We're writing up the paper on that. The other project that we submitted for publication and waiting to hear from the reviewers is that we did a work study with the World Trade Center rescue and recovery workers. And these were also individuals that had MCI, or mild cognitive impairment. And we did some performance tests with them. It was a different kind of test that was looking more at reaction times. And we saw that there was a significant decrease in their reaction times with the light exposures. They were exposed to the light, and we looked at pre and post performance, and we saw better performance with the lights. Now, I can't go into details here because of the time, but we do know that light increases alertness during the day and at night. But it does not have to be blue light, which is very interesting. So I always tell that light is almost like a cup of coffee. And what I want you to remember is that the lighting characteristics for alertness are different than those for circadian entrainment, which is more sensitive to blue light or bright light. So we have shown that red light, which does not affect the circadian system, will affect alertness. So in the middle of the night, when you don't want to suppress melatonin, you may expose yourself to red light to stay awake. And we have some data from nurses that we're seeing very positive impact on night shift nurses where we're increasing alertness without affecting their melatonin levels. The last one that I want to talk about, which I already mentioned, it is the falls risk. We have shown that these horizontal vertical lights, we installed them in assisted living facilities in North Carolina, working with our collaborators at UNC. And we did see a decrease in falls by 34%. So when we turned on those horizontal vertical lights, we followed the patients for months to look at falls rate, and we saw that there was a decrease of 34%, which is a large number. So we're starting to see manufacturers now developing these horizontal vertical lights, and I'm really think that it's a very simple and elegant solution, and hopefully will be a useful solution for reducing falls risks. Now, how to implement these comments. I mean, I talked a little bit about what is the tool, what you need to implement. I talked about the science behind it, but Jan Brons will be doing the how-to. She will really be talking about how is it that we do that in the design. So stay tuned and attend Jen's presentation. So just to conclude, light and dark can and should be used as a non-pharmacological intervention to improve circadian sleep disorders, mood, and improve behavior. Need to be appropriately specified and measure the stimulus. Light is just as important as darkness. So you need bright days, dim evenings, dark nights. Light can also aid in improving postural control and stability. Light can be used as a cup of coffee, and I didn't have time to give all the science behind that, but I tell you, there is science, and maybe we'll do another webinar just on the alerting effects of light. And I think that the future is really, every person might have an app where they measure their light exposure, they give that back to an app, and they basically get a prescription at what is best for them. Because one of the things that it's important is those are all general concepts, but individuals are different. And I think eventually we're going to have to go to a more individualized solution. So I always say, is that a precision medicine with light? Is that really what's going to be true human-centric lighting, is when you have something that it's for you and only you, and you can control your lighting around you or your behavior to increase lighting. So I think that's sort of the future, and hopefully we'll see a lot more with that. So with that, I do want to thank you for your attention, and I will turn it over to Patrick.
Yeah, so thanks, Mariana. That was amazing. A lot of good comments, and we do have some questions. One of the things I wanted to know, to reiterate with you, obviously a walk or exposing to light can be equal to a cup of coffee, and I would like to delve further into that with you at some point in time. So we'll have to do more webinars together. And habit. We talked about this in the original panel, but you said habit like exercise, or that puppy waking you up every morning to go out and get a walk. Good exposure to light, bright days, etc., should become a habit if you want to stay healthy and you want to sleep well. So doing it one time doesn't necessarily help you long term. It needs to be a focused habit of your everyday living.
Correct. Regularity is very important as well. It's not just bright days and dim nights one day. It really is a regular. Mark always says that a healthy light is a boring light. A healthy life is a boring life, because you really need to be regular. And if you get out of that regularity, you're probably, not being very healthy.
Sure. Okay, well, let's take some questions because I could talk to you all day long about this stuff. One of the questions came in, how does macular degeneration affect light for the circadian system?
Interesting enough, obviously, every time you have any vision problems, if you reduce the amount of light in the back of the eye, if you reduce your ability, the photoreceptor's ability to respond to light, you will reduce the impact on the circadian system. But macular degeneration tend to be peripheral issues. And one of the studies that we did, we showed that a lot of the apparatus for the circadian system is actually on the central vision. So it's light reaching sort of the middle of the eye, right at the central vision. And luckily, macular degeneration doesn't affect as much central vision, or it takes too long to zoom in your central vision because it's mostly a peripheral one. So while it will affect, because any eye disease will affect, the effect is less than, for example, oh, I'm sorry. You asked macular degeneration. Erase everything. I confused the two. I was talking about glaucoma. Macular degeneration is a problem because you're losing your central vision and you're losing a lot of your ability to respond to the light. So apologies, I mixed up the glaucoma with the macular degeneration.
Sure,
So
sure.
yes, it will be affected because you are losing a lot of your central photoreceptors.
Got it. And I'm going to jump back and forth between the Q&A and the chat because we have questions in both, Mariana. Could you
Sure.
elaborate on the differences between HCL and circadian rhythm, more specifically, the definition to use the terms accurately? How would you
Well,
differentiate those two terms, even though they kind of intersect in a way?
yeah, I mean, I think human-centric lighting encompasses more than circadian rhythms. Okay. I think the difference is that we have always thought about lighting as lighting for visibility. And now we know that lighting affects more than visibility. So we have to take into account these other parts of the brain that lighting affects. So circadian rhythms is just the rhythm in your body that you have that is generated by your biological clock. It really has nothing to do with human-centric lighting, but human-centric lighting encompasses circadian rhythms. So human-centric lighting is designed to affect circadian rhythms. So they are totally different concepts in a way. It's just that one includes human-centric lighting, includes how light affects circadian rhythms.
Sure. Awesome. And I think you might have maybe answered this half hour to 2 hours, but I'm going to ask the question so you can qualify. How long do you need morning exposure if you're in outdoor light or sunlight? Is it still that half hour to 2 hour range?
Yeah, I mean, a minimum of half an hour. There was a study showing that 2 hours is ideal. After 2 hours, you really lose the benefit. I know not all of us have 2 hours to be outdoors in the morning, so I recommend between 30 and 60 minutes at a minimum, and that's pretty good.
Awesome. Awesome. And Artie's asking, can you reach a specific saturation point if you were to load up with a fair amount of lux in the office setting?
Yes, the circadian system actually has a saturation at about 1,000 lux at the eye. So after that, you pretty much don't have that much of a benefit. And 1,000 lux at the eye is a lot of light. So, what I see from the studies that we have done, you go above 350, 400 lux at the eye, you're 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 pretty much at halfway of the saturation curve. You're being effective. You can go a little bit higher if you want, but above 1,000 lux, you're just basically wasting energy in a way.
Oh, awesome. Awesome. And are there different pathways to it, a learning effect?
We think there is, and that's really the I think the neat part of the research that I hope to eventually delve in and get funded to do more work on that. I think there is. I mean, I think there is a pathway through the biological clock because we know that blue light is very effective at alerting people. But the red light, I don't know if it goes through the SCN. It could go through another part of the brain that then feeds back into the biological clock. I don't know that we know that. I think this is still a research question, but I do think that there are different pathways for sure.
A few more, Mariana, if you've got time, we'll keep going here.
Yeah.
Harlow asked, how does lighting affect depression? I think you covered that in the slides, that obviously more exposure to light and better benefits the circadian system actually helps reduce depression. You found in both Alzheimer patients and elderly patients, lots of different studies, correct?
Yeah, and again, I think that lighting can help you sleep better, which can then help with minimizing depression. And there has been shown, obviously, in animal studies that there's a direct pathway from uh, uh, the IPRGCs to the amygdala, which is one of the centers in the brain that is associated with mood. So I think that there are pathways, and again, I think there's things related to serotonin and melatonin, um, because we know that serotonin is also participates in mood response. So I think that there are different ways. We have a hint that light actually, um, is it increase serotonin production? Yes, it increases serotonin production. So I think that there are different pathways, and people are starting to look into it a little bit more, but there's clearly an effect. In fact, mood has been one of the areas that we are seeing one of the greatest impact of light after sleep.
Got it. Interesting. Here's the crux of this question. Do you know of any studies on incarcerated people? And she's saying studies need to be done for people who are incarcerated in windowless county correctional facilities. Most of the people incarcerated in county facilities are suffering from substance abuse, mental illness, and will return to communities as supposedly rehab functioning citizens. Do you know of any studies that lighting is being done in these facilities to try to, and is there a better success rate in rehabilitation coming out of that? I see you
I
smiling, so
think,
obviously, yeah.
yeah. Well, first of all, we did start a study with the Ohio Correctional Facility exactly on that, but unfortunately, there was so much problem with the lighting there that we couldn't do the study, because the lighting system was acting up, or the guards were messing up with the lighting systems, and they were keeping the lights on all night. So it was, to me, it's, that's actually so counterproductive. But I do believe that there's a huge potential for using light, because we saw, interesting enough, a reduction in agitation in Alzheimer's patients. And you wonder if you can reduce aggressiveness and agitation in people in these facilities. And if they are in constant dim light or constant bright light, this is not good. So I think that there's a huge potential there, and I'd be very interested to do a study there. It's too bad that it didn't work, but I think there's huge potential, huge potential.
Sure. One more question in the Q&A, Mariana, then I'll jump back to the chat. Is that 2 hour outdoor exposure anytime or only in the morning? And I think you said that it will give you a boost anytime, but the morning is the most important to kind of start and regulate the day.
Yeah, it sounds like for circadian entrainment, yes, the morning is the most important one. Now, we do count every photons, right? And it's a balance between morning and evening light. So don't forget the other parts of the day. But if you're talking about circadian entrainment, the way we have been doing our studies and we're seeing success, it's giving that light within 2 hours of waking. And that's really where we see the maximum potential. Now, again, for um, a cup of coffee any time of day, I mean, in fact, we saw a strong effect of red light for the post-lunch dip in the middle of the afternoon. So you can have different designs and different options to serve those different systems. But for circadian entrainment, I would recommend light within 2 hours of waking.
Awesome. A lot of people are asking for the slides, Mariana. Will those be made available?
I can. There are some unpublished data, so I may remove those, but for the most part, yes. Those are all published studies, and they are being cited in the slides. So you're welcome to get them, PubMed or Google Scholar. All of these are available.
Okay, awesome. Awesome. Let me see. Let me scroll down here. Lots of thank yous and praises for your presentation, Mariana. Everybody loves you. You probably already know that. I tell you that all the time, and you're very humble. You're very humble. What are other recommended factors within our control that can contribute towards a more circadian and trained lifestyle? Diet, activity, etc. I think all those, if they leads to healthy living, probably helps. But they're asking you the question, not me, Mariana.
Well, this is a new area of investigation, and some of the studies we're starting to do now, we're starting to monitor food intake and diet, because we know that food does interact with the circadian system and so on. It's not as strong as light, but it does interact. So obviously, regular eating, just like you have regular lights, is important. And exercise, obviously, and if you exercise outdoors, you're getting your light too. So all of these are things that are reinforcing a healthy circadian system. Light is the main one, and that's why we work with lighting. But you could have combination of interventions to actually reinforce that healthy lifestyle.
Sure. Are you okay to take a few more, Mariana?
Yeah, I have a 3 o'clock, but a couple more minutes, it's okay.
Okay, so since you mentioned outdoors, this next question, we can use this concept in sport lighting, and how can we introduce it?
Um, you can, and there's a couple things. I mean, obviously, if sports people travel across time zones, you can start re-entraining them so that you can have them play in their peak performance. There are circadian rhythms of performance. So there are times of day that you're more better performance than other times of day. So you could do a lighting prescription that you actually would phase shift the biological clock of the players so that they are all playing at peak performance. So there's definitely opportunities to do that to help them with that. Those, phase shifting their clock for peak performance or giving them that boost, that alerting effect. Both of them are things that could be done. Now, granted, for that, you have to control your 24-hour light exposure. So it's not as easy, but performance people are very dedicated, so definitely I'm sure they would follow prescriptions to be successful.
Awesome. This person asked if you studied folks who suffer from color blindness in reference to circadian stimulus. Is there any difference there?
No, I think there's so much redundancy in the photoreceptors. The only one that it's very rare and we never studied, so it has not been studied, is the one that don't have the short wavelength or the blue cone. That's very important for the circadian system, and obviously the IPRGCs. So there hasn't been studies looking at if they've missed it, but color blindness typically is the long and middle wavelength cones. And because there's so much redundancy between these cones, so there shouldn't be a huge effect. Now, the next question would be for blind people. Blind people will be able to respond to light if they still have their IPRGCs functioning. If they have no light perception, they're probably going to be like in a dark cave. They're going to free run and they're not going to be able to entrain. And that's where oral melatonin or a very rigid schedule can help them because they don't have the light information.
Awesome. Awesome. Well, last one, I promise, and I'll apologize to whoever you have your meeting with on my behalf. Please apologize to them. What are your thoughts about sun lamps being utilized as an alternative to natural sun? Now that winter's almost near, a lot of people are experiencing seasonal depression disorder. And so I think, again, any kind of light exposure and high intensity at the right plane to the eye is helpful, correct? But again, they're asking you the question, not me.
Yeah, I mean, first of all, we don't know what sun lamps are. There's no real definition of full spectrum sun lamps and all that. So that seems to be more of a marketing thing than a real thing. Any light sources that you can increase the amount of light at the eye, you should have the same benefits. So I wouldn't pay more for a marketing lights, I would increase the amount of light at the eye to at least, 350, 400 lux at the eye, and do it regularly. You should have the same benefit.
Awesome. And the compliments, Mariana, to your presentation just keep coming. So thank you so much.
Thank you,
Anyone else?
everyone.
Yes, you did a great job. This recording, this is recorded. You can go to waclighting.com to get the recordings there. They will be made available, all of these presentations. They'll be available and up in the next couple of days. Support the LHRC. If anybody wants to be able to learn more, there's things posted there. And you can always make donations to these studies. To any studies, they're always open to donations there as well. So, Mariana, I can't thank you enough. Appreciate you, and Mark's been great. I know Jennifer will be great next month. So, thank you very much for taking the time.
Thank you, guys. Bye bye. Have a good one.
Appreciate you. Thank you. Bye bye.
Bye.